Very welcome to you. And some doctors may join a little later. Let them join, but as we are in time, we like to start now. So, this is our institute. Usually, the pictures are part of clinical assessment. And whatever actually we do in the picture, we just look at the pictures and have an idea and try to memorize something. But today, what we like to discuss is the inner philosophy of a picture. What ought to be seen in a picture? We will try our best to discuss. Actually, this is not the only for the equity. Today's discussion definitely will be helpful for any other exam, especially in the written exam where the pictures are given. Nowadays, throughout the world, any exam is given with the picture for your assessment. What is the philosophy of giving the picture? Suppose in any clinical exam like OSCE, few cases are selected, clinical cases. So how to cover all other clinical patients? To cover it, usually in the written exam, the pictures are given to cover many pictures. So today, it is very fact that we will not show you all the pictures, but a few pictures for your development of understanding we will discuss. And today's session will be in a manner of interactive. And actually those who unfortunately don't like to interact, you will get very minimum benefit. But who try your best to interact in the picture discussion, you will get the best benefit. I hope that you will feel encouraged to interact with us. Okay. So if first picture is given to you, many of you have seen in our textbook. Can anyone try to say that what information you are gathering from here? I will give you actually what is our deficiency of lackings to look at the picture. And I will tell a little more than the book to you now. Please, anyone can share here to say something about the pictures. What picture is telling to you? Anyone can try.
Just man.
Yeah, doctor, please. You're muted again, doctor. Can you try? Be unmuted again.
Chest pain, Sandra, chest pain.
Yeah, I can hear you. Yeah. It's a chest pain. Very right. Very right. Chest pain is here. Is it severe? I'm not telling the diagnosis, doctor. Just message from the picture.
Okay.
Message. Anyone can say. And anyone can say the details, what you are getting the messages here. One is the chest pain, very right. Yeah. Yeah, doctor, please. Any other message?
The pain is radiated to the throat and the left arm.
Yes, very right. No other information. What is the age of the patient, doctor?
Old patient, smoker.
Old patient, smoker. Very good. Then quickly, please. If you interact, then I will feel to tell more also as well. Any other message? Very easy to say. Can anyone say what is the severity of the pain? Is mild pain, moderate, or severe pain?
Severe pain.
More likely severe pain. More likely severe pain. And any other message? Many more messages are here.
He was probably holding the bag, and because of the pain, it just fell off his hand.
Yes. That means again is
So
the features of severity.
Severe.
It's again the features of severity, right? Any other? If I tell that it's coming out from a restaurant after eating heavy food, I think all of you will agree. Right, doctor? Please be connected and talking with us. And it's going up a stair. You see, there is a stair going up a stair. So it is exertional. And what is the temperature outside? Dr. Sarah, please. What is the temperature outside?
Cold.
Cold. Yes,
yeah.
just diagrammatic, the fall of the cold, the flow of the cold wind, and he's wearing a very heavy cloth. So many of these things will make us very easier to reach a diagnosis. And one colleague today said that this is ischemic heart disease. Possibly you have seen the picture in the book, maybe or may not be. but we have to consider everything. So if the messages are so in a patient in front of us, so very easy to diagnose. And this is the understanding. You see now in the book, a lot of information is not written. What you have said, someone of you, that the typical ischemic cardiac pain by the picture. Actually, picture will talk to us like a patient is talking to us. But what you described nicely, all things are not written in the book even. So I will show you today some pictures. I like to hear from you what you will say to me. So this is a picture of the ischemic heart disease, history and others. So this is the lady looking to you. Can anyone say your observation by looking at the face? Face means you see this is the hair. If you go down forehead, the eyes, eyebrow, eyelids, eyeball, sclera. People not much visible. The picture is the nose and these are leaves and face. Dr. Reem, please, what you are thinking? What your observation?
Right lower motor.
Bell's palsy.
You are thinking that Bell's palsy. So is the facial deviation obvious here? Anyone can say different? Anyone? Can anyone say something different? Bell's palsy will be visible more in the ear, nasolabial fold.
Right lower motor neuron facial palsy.
Facial palsy. Why you are thinking, Dr. Facial palsy? Please, Doctor, can you try to explain? If you cannot express, your understanding will not be too much strong. You can say something, but we will try our best to explain also. And very, very right you are there. There is a partial ptosis, you see, the partial ptosis. And look at the forehead. You see, the right forehead is more active than the left. Anyway, it seems to be a picture of Horner syndrome. And now we need to see the eyeball. Eyeball means the pupillary reaction and others. As this is my patient, I know that actually patient is not of Horner syndrome. The appearance is like that because sometimes we say that congenital Horner syndrome. Anyway, but look at the face. My attention to you, just as much as you can scan your picture, you can identify your picture. So I hope that today we will show you the pictures actually is our personal collection, not from any other source. If you come here, can anyone say in the foot and just in one word you can say what you are observing. No need to explain also. Patient presented with foot pain, and the foot pain will develop overnight. Yes, please. Sorry, doctor, your voice not clear. Anyone?
Swelling.
There is a swelling and redness. What is the probable diagnosis?
Gout.
Very
This is
right.
gout.
Yes, very
Gout.
right. The name is the podagra, not tophi, doctor. Sorry, correct yourself. Tophi is a feature of chronic gout. This is acute gout, redness and swelling in the first metatarsophalangeal joint. It is not tophi. There is a soft tissue inflammation also here. So this is the podagra. Okay. And here, please, anyone, what actually done here? Some test done here, clinical examination done here. Please, anyone? We are in a small group discussion, doctor. Don't feel shy. Anyone can interact. Can anyone say what actually done here?
This Bell's palsy, I think this one.
Diagnosis could be Bell's palsy, but what is done? You have done one maneuver here. What maneuver? Bell's sign. Bell's sign. Bell's sign is positive, for this is the facial palsy. Please, which side of the facial nerve is in problem? Anyone? Which side? Left or right?
Right.
Right. So you see up rolling of the eye when you instructed to close the eyeball. And we have to look at the face also as well. If it is a lower motor facial palsy, this is the Bell's palsy, and the upper part of the face will be less active. Less active, not totally inactive, because there are some bilateral supply. When we see the facial palsy, we need to see actually in the forehead, whatever the muscle of the forehead is inacting or not. So this is the Bell's palsy. It's very common, doctor. It's very common. And even in undergraduate studies, you have seen. This is the Bell's palsy, lower motor facial palsy. Now in oral cavity, this I will not tell detail, but you think yourself to look everything and tell that this is an. You see, there are some ulcers, but not healing. Not healing. Few weeks over, given some treatment, thinking that it may be acute problem, but it is not healing. Few weeks. What could be the possibility of this? Can anyone, doctor?
CA.
Aphthous ulcer.
Ulcer is there, but what is the type of ulcer? More likely,
Aphthous ulcer.
less likely. Doctor, aphthous will not persist weeks together. It will come and go. Usually will be small and multiple. Maybe in single, no doubt.
Can be carcinoma.
Yes, we have to think carcinoma. Doctor, what other features guiding you to say carcinoma other than the ulcer? Now the challenge to you of a picture. Okay, you have seen area and other, what you got information by
Please.
looking whole picture? Even by looking the
Poor
color.
hygiene, look like chronic
Eh,
smoker.
Smoking, no doctor. This is not too much black, like a smoker. Any other? What the age of the patient? Age, younger or elder?
Elder patient.
Yeah, the senior citizen, right? Elderly lady, and you see the white cloth also, especially in the South Asian culture is like that. And I look at the skin texture, doctor, the appearance of the skin also saying that this is elderly lady. So any elderly lady persisting symptom can give an idea, is it a malignancy? Is it a malignancy? So we are thinking that it could be a malignant tongue ulcer. Then you have an idea, even without touch also you can have an idea by looking at your patient. So a picture is shown to you means we are showing a patient to you, part of the body. Now come here, I just say this actually is a lady having pain here in first night. There's a little redness is there. I think still you cannot identify what could be the wrong. Later on, patient develop the next day, same area, this thing. What is the diagnosis?
Herpes.
Herpes zoster or herpes simplex. Which one?
Herpes
Varicella
zoster.
zoster.
Herpes zoster. So possibly in a dermatomal patient. So here the symptom is important. Initially, before appearance of the skin lesion, patient will feel only pain. So you will face such question also later. So herpes zoster. Now here, doctor. Can anyone say what is the diagnosis? You see, look at the face. You see that some papular or vesicular lesion here in the forehead. Some maybe in the upper eyelid also not much clear. And
Could
this
be
is also
European syndrome or
which syndrome? This is also painful. This is also painful.
that's herpes infection.
Is this
Herpes.
herpes
Which
too?
herpes?
Rantina syndrome or not
Herpes ophthalmicus.
Ophthalmicus could be. Yes, very
Ophthalmicus.
right, doctor. Herpes zoster ophthalmicus. What is the importance of knowing this? Ophthalmicus for the management purpose?
We need to refer it because it can cause blindness.
Fantastic. Immediately we need to refer to whom? Refer to whom?
Ophthalmologist.
Ophthalmologist.
Ophthalmologist. Very right, doctor. This picture captured in Saudi Arabia, doctor. Those who live now there, you understand. This patient of there, he is residing there. Anyway. So now come to this one. Long-lasting appearance of the tongue. Patient is worried. Doctor, what is wrong? Why I am not getting better? Months together, years together. Doctors are trying to give many medicine, not failing actually. What could be in the tongue lesion?
geographic tongue.
Geographic tongue. Geographic tongue. So what is the GP's responsibility? To give more medicine?
No
Or
reassurance.
expression, reassurance.
Yes.
Reassurance, explanation. This is the glamour of family physician, doctor. That medicine is not the main thing for us. So this is the geographic tongue. Very right. And here again in the mouth, there are some vesicular blistering smaller.
Impetigo.
This is supposed to be
Impetigo.
impetigo. Impetigo. But why not? This is herpes simplex.
Because it
What?
has got secondary infection now.
So you are thinking that the herpes simplex with secondary infection?
So honey
The
crust
crust
appearance is an
is
Honey
impetigo.
crust.
Everybody will tell us the honey color or golden color crust are there. But I'm asking that if what you said very nicely before, there was herpes simplex and complicated by the infection by bacteria. For that you are telling that this is impetigo. It may be one explanation, but is it the place of appearance of the herpes simplex? Who can say?
No, because there are no vesicles in it.
Vesicle could be there, doctor. If you cannot say, I'm telling that there are some vesicles also. More likely they're crusted.
Brown crusting or
Yeah, more likely they're crusted. Okay.
golden.
I am asking that not the appearance of vesicle or something. The location I am telling about. Suppose this is the location. Mucocutaneous. Yes, this is the answer. If it's a mucocutaneous lesion, more likely it could be herpes, but it is not. You see, the leaves are intact here. Huh? Good. And very common picture, doctor, in MRCGP exam, in AKT, even in the other clinical exam also. Clinical means the written exam. Now you see, look at the face and around the mouth. There are some similar crustulation. Is it impetigo?
Yes. Yes.
Impetigo. Any difference of opinion?
Eczema herpeticum.
Herpes simplex. This is the herpes simplex. You say here, 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 and in the mucous membrane also. You see here, mucocutaneous junction. This is the typical site of the herpes simplex virus. Herpes simplex labialis. So your attention is important. to
Doctor,
look at the
please.
picture.
Can you explain again how to differentiate between
You see
the two
that
herpes?
if you compare the previous picture with this, I'm just comparing with you. See, if you compare these two pictures, so you see the lips area is very clear, not in bulb at all. But here, though you are seeing some crust are there, but there are some vesicular lesions in the mucocutaneous junction. So you just compare with the picture and here. So this is impetigo and this is herpes simplex. Okay. Don't sleep, doctor. We can proceed. Some other pictures according to the sector now. And very happy that you are interacting. I told you who interact, you will learn more. Your brain will and be enriched. Now look at the picture. This is an young patient. Again, he is also my patient. And you see, this is a very from after birth. He was having some swelling here, and he's moving here and there. Nobody's operating him. You see, the surface is irregular. I'm giving some clue, maybe a critical picture for that. Surface is, you see, not as the left side is smooth, irregular. Up and down is there in the surface and warm. And when you feel there, you find that there's some pulsatile feelings. What could it be? What could it be? Please, anyone?
Could be malignancy.
I'm asking the tissue of origin. Could it be muscle? Could it be bone? Or could it be blood vessel or any other thing?
Parotid gland.
Parotid gland will be pulsatile, doctor.
Can it be mumps?
Again, the same thing we're telling Dr. Parotid gland. From birth, doctor, you think that moms starting from the childhood and until this age?
Lymphoma.
Lymphoma from the child, doctor? Many things
Lymph
there
node,
to exclude. And this is the,
Hemangioma.
okay, many things you are telling. Just when we analyze a patient, again, though time is very short, doctor, I will not take more time. When you face a question, even you learn, you go through your question bundle, always think, doctor, the age of the patient, the progression of the disease. What you said, someone that is a parotid, how could it be parotitis? Moms, it's a matter of days only. But I am telling that this after his birth, he's feeling this thing and persisting throughout his life. And until, if it is not operated, until his death, he will have it. So it actually never be a mumps. Mumps is an infectious disease. So always think it. And someone said that this is hemangioma, doctor. Why you are telling hemangioma? Just a few words, few seconds. Why hemangioma?
Because it's pulsatile.
Very right. Fantastic. Versatile. Warm. You see the irregular enlargement of the vessel showing this thing. This is actually hemangioma. Maybe from the artery there. Any mini artery there, right? Facial artery and other artery. Very, very good, doctor. Thank you. Thank you very much. Now here, what you are looking at the face.
Xanthelasma.
Xanthelasma. Xanthelasma. What may be underlying disease, doctor?
Hypercholesteremia.
Hypercholesterolemia. Immediately you know
Diabetes.
that diabetes is not directly related. Diabetes is associated with the hypertriglyceridemia. So more likely hypercholesterolemia. Which type of hypercholesterolemia? If I ask that, acquired or hereditary?
This familiar.
Hereditary.
Hereditary. So familial, rather hereditary means familial hypercholesterolemia present with the skin feature. Remember, the skin feature usually indicates the familial dyslipidemia. So this is xanthelasma. So our duty is to exclude underlying dyslipidemia. Sometimes it is found, I don't know what is your experience, that patient having only xanthelasma without any hyperlipidemia. Significant number of patients having it. So patient is worried for what? Cosmetic purpose. So we will try to give some suggestion, removal of this thing. Special dermatologist can do something. Anyway. Now look at the patient, doctor. What you are looking?
Goiter.
Goiter. Very, very right, doctor. What is the nature of the goiter? Nodular, diffuse.
Diffuse.
Diffuse. So,
Diffuse goiter.
very right, very right. So if the patient is diffuse goiter, having diffuse goiter, one of the diagnoses could be Graves' disease. Am I right?
Graves.
disease.
Yeah.
Now look at
Yeah.
whole of the picture, doctor. I told you always look at the whole of the picture. Is there any other feature that it could be Graves?
The eye.
Can anyone say? Look at the eyes.
Eye symptoms.
So is there any picture of the Graves' disease in the eyes? In the eyes? Any proptosis? No. So, and another feature I'm telling you, patient does not have peridibial mixed edema in the leg. So only diffuse goiter more likely. What could be the diagnosis now? Probably. Patient does not have features of, I'm telling you, patient does not have features of the thyroid dysfunction. Maybe it is not hyperthyroid, it is not hypothyroid. So now what could be the diagnosis?
Hashimoto's.
Sorry, Dr. Hashimoto will not be without dysfunction. Hashimoto will have initially hypothyroidism, short stay with the U and immediately go to the hypothyroidism state for life.
Simple goiter.
Yes, the term will be simple goiter, simple goiter. So when you look at your chamber, doctor, immediately you can identify that. And but to be confident, we will give the investigation of this, but patient telling that many years he is having such thing without any thyroid dysfunction, a diffuse goiter, immediately and confidently you can say it is a simple goiter, and there is some geographic location also the people having. But if it is nodular goiter, it is dangerous. Nodular. So it is not the talk of thyroid disease today. Nodular should be evaluated further. This patient went to the salon, you understand? The parlor rather, to have his hair cut and color the dyes. Immediately after this day, he got the lesions like this, redness. I'm not telling the findings, you can identify. What happened to him? He's actually residing in the Gulf country and came to his native land here.
Allergic dermatitis.
Allergic dermatitis.
Allergic.
Yeah.
Someone said non-allergic. What is the difference between
Dye.
allergic and non-allergic?
By,
First to say contact dermatitis. Now basically simply two types. Contact dermatitis of irritant contact, another is allergic contact. Now which one? Irritant or allergic?
Allergic.
Allergic. What is the reason to say allergic?
Onset is very early.
Not onset, immediately after the contact. Okay, you can say a little later. There may be clue, one day later. But the extent of the involvement, if it is only in the site of the contact, it is irritant contact. But you see the lesion come down here. And even maybe somewhere else also. Other than the site of the contact, it is allergic contact dermatitis. So by looking without asking a patient in the skin disease, you can identify this allergic contact dermatitis, right? A baby having a congenital disease from childhood, look at the face and look at the hand. What could be the
Down.
diagnosis? Down.
Down
What is the reason,
syndrome.
doctor? Doctor, why you are saying down?
One line.
One line. What is the name of this line?
Semian crease.
Premium crease. And in the face,
Mhm.
doctor, if it is true, and what you are getting in the face?
Down picture.
Sorry, doctor, you said the down big face. It is not enough. We have to describe a little. A pigmented eye fold. A pigmented eye fold. This one. Little nasal impressed also seems to be. This is also our patient. A few years before I captured this young boy. And I think in the case, especially Saudi Arabia, it's a few number rather to say of baby having Down syndrome. They have many society also, Down syndrome society. Very right. Now again, if he was in my chamber, the picture is not so much better. Have an idea what could be underlying disease.
Eye.
Quickly.
Eye.
There is a goiter, diffuse
Goiter.
goiter. Now tell the diagnosis.
Okay.
Possible diagnosis. What you will say?
Graves
answer.
Graves disease.
Graves
Graves.
disease. Yes,
Graves.
Graves disease.
There is
Graves disease.
process.
And you see the eye seems to be proptosed.
Fructose.
The remaining, you know, how patient present, restlessness, sweating, weight loss, other. So this will be possible case of Graves disease, not simple goiter, not simple goiter. Okay. Again, look at the neck. What you are looking. This lady. This is the radiation mark I am telling you, and it's then after operation, he is getting the radiation here. What happened to her?
Carcinoma.
Carcinoma in the neck. Where carcinoma was, you can see the scar mark is there. Appearance of a scar mark. Which carcinoma could it be?
Papillary.
Sorry,
Papillary or medullary?
why not thyroid?
Follicular.
Thyroid carcinoma. Thyroid carcinoma. Thyroid surgery, post-thyroid surgery, scar mark is like that along the crease. So thyroidectomy done, and after that is getting the treatment. It means actually it was the enlarged thyroid, more likely due to malignancy, right? But if we are able to identify, this is the, you see the special area and the burning by the radiation. So this is thyroid malignancy. Thyroid malignancy. I am not showing the faces, eyes. You can have an idea that is a relatively younger lady, not elderly. Elderly. And what is this, doctor? Can anyone say of South Asian origin? Anyone from here? What is this? Maybe in the Middle East culture also having this rope. There are something.
Tabiz.
Yes, this is called tabiz. Anyway, what does it mean? Patient wearing this thing. There is some message also. The patient is suffering from a chronic disease and patient is suffering from non-treatable. More likely, a patient thinking that the disease is not healed, will not be healed anytime. Maybe like that. For that patient are dependent on traditional healers or some religious scholar also. I don't know any of other colleagues from other country having the culture or not. Anyway, this is another message. Now look at this lady, and she's also having this scar mark here. And she was also under thyroid surgery. What may be the reason of that surgery? Look at the face and everything. Was it a malignant case or not? Dr.
Patient
Said,
seems healthy.
healthy, seems to be healthy. So was it malignancy? More likely or not?
No, not malignant.
Not malignant.
There is no mark of radiation.
Yeah, what was the indication of surgery here? Say one or two possibilities. You will say different. Could be that very large
Cosmetic
goiter,
purpose, this
cosmetic
large goiter for
purpose. Yes, very large goiter over
multinodular.
there. Maybe Graves' disease also, right? You see, seems to be used a lower visible sclera termed as proptosis. But don't look at the upper eyelid rather. By definition, the visible sclera in the direct horizontal vision termed as proptosis. So if it is said as proptosis, if you keep it, so it may be the Graves, and enlarged goiter in the Graves may need surgical removal also. Okay, if you think that, okay, normal variant may be like this, it is not the goiter. Maybe any cosmetic purpose is there. Again, there was maybe simple solitary goiter, not simple, rather, initially it was simple. Maybe there was suspicion of the malignancy. Small goiter. Before appearance of malignancy, it was removed. Could be. That actually we are discussing indication of thyroid surgery. Right? Or enlarge, even the simple goiter, if you enlarge and compress the trachea also, it needs removal. So that is the thing. So appearance will tell you even the indication of surgery. Right? That is our motto to tell you, doctor, that how picture is talking. Now, doctor, look at the face, this lady. Again, this is our patient. Look at the face, you see the white areas are there. This picture is telling many things. Immediately, all of you can say that, what is this?
Vitiligo.
Vitiligo. But this picture telling more. Vitiligo is the presentation of autoimmune disease. Patient might have other autoimmune disease. What could it be? Look at top to bottom of the picture. If you have something in your mind, definitely you will ask some question, relevant question. And relevant question is the part, doctor. Those, I don't know, maybe anyone from the OSCE participant in the patient, that we need to ask some other associated condition of the patient. Any other message are you getting from the picture? Any undergrad student also can tell that there is vitiligo, but is there any other features? Is there any other autoimmune disease association? Could it be here, the female? Can you look at the hairline, doctor? Look at the hairline.
Alopecia.
Alopecia. So, a female having alopecia, what could it be? Cannot guess. Patient having joint pain, multiple joint pain. SLE. If you think SLE, now you will ask some relevant questions of the SLE. What question? Photosensitivity. The sunlight, having discomfort or facial rash in the malar area, now or before, oral ulcer, many other things. So this picture is giving you maybe that idea. This lady developed this phase overnight. Actually, this lady was working maybe in our medical college somewhere, and she attended. What is the name of that?
Geriatric edema.
Yeah.
Angioedema.
If you say the anaphylaxis, it could be extensive presentation. Itching, redness, hemodynamic instability could be there, breathlessness, but patient does not have any other thing, only the facial appearance. But the very fear is that patient may develop anaphylaxis. So allergic reaction, there is a spectrum from simple urticaria to the anaphylaxis and anaphylactic shock. In between, the angioedema. Angioedema like this, the eyes are buried. Yeah? There are different types of angioedema, history will tell you. So this is angioedema. Thank you. Now look at the face, doctor, who can say what you are thinking about. Complete your answer, doctor. Which side? Upper motor, lower motor, everything you need to complete in your sentence, doctor.
Left lower motor neuron pulse.
Left, lower motor.
No,
facial
upper
pulse.
motor neuron.
Why, doctor, upper
Lower.
motor?
Yes, mouse deviated to right.
So this is the left side, but why you are telling upper motor? Look at the face, upper part of the face.
Upper.
Is
No,
there?
lower.
Now you are seeing lower. So compare this. So a minute observation is important here, that the forehead muscles are wrinkling and it is an similar almost or not. So this is a flat, right? This is flat. This is not in action. This is not in action, more likely. So if it is so, it could be lower motor facial palsy, maybe Bell's palsy. Then our job to show the Bell sign. How to say, can you close your eyes? Then you will see the Bell sign, more likely. So it's a peripheral nervous system disease. If it is, suppose, not Bell sign, the Bell sign is not positive, only the face and the upper part, that's the upper part of the face in action. So you are telling that is an upper motor facial palsy. That means left-sided upper motor facial palsy. So where is the lesion? Lesion is not in the brainstem. Lesion is in the cerebral cortex. Which side, right or left? If face is
Right.
in the left problem,
Right. Middle is right.
right side. But if it is a lower motor facial lesion, which side lesion, left side or right side? Facial nerve. Left side facial. If it is a lower motor, Bell sign is a left-sided facial nerve palsy. If it is the upper
Yes,
motor
it's
lesion,
central.
you are
Opposite
thinking
cross.
more likely opposite, Anyway, those who are interested in the neurology, where is the lesion? You can go through our YouTube link also to identify the focal lesion. Anyway, so now look at this young man face. I'm not telling the history, but looking at, is the face is normal? Just simple
Cushingoid.
question.
Cushingoid.
Cushingoid. Why you are telling the
Yeah.
cushingoid?
Moon face.
Moon face. Doctor, have you seen a lot? I think a lot of picture like this round and other in a bulky man. Why you are telling moon?
Buffalo hump.
Buffalo hump? Where is the buffalo hump? It's not shown here, doctor. Where the picture given from the back or side, you can identify. There's no buffalo hump. The patient only looking to you. You can say that a plethoric face. So maybe the camera focusing may disturb you. The yellow background is there. Other than how to say the moon face. If we look at each other, even the bulky round face people, you cannot actually you can see both ears easily. Ears, you see. Dr. Reem and other who was connected. Can you see the ears clearly?
Yes.
No.
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 Ears are not visible clearly, and the face is round. This is the moon face. This is the moon face. Otherwise, any round face, you can see a lot of people having this round face. All are not moon face. If it is the moon face, more likely diagnosis is what? What, doctor? Cushingoid, but Cushing or Cushing syndrome.
Or on patient on steroid or something.
Anyway, maybe due to any reason. So what you look for in the abdominal wall?
ضمن السراير.
Is it the same?
ضمن
Is it the
السراير.
same?
Strium.
That is, you are looking this thing. The right side picture, Dr. C. Are you looking this appearance in the skin of such patient? Doctor, you are telling something, but you cannot answer by looking the picture. Is the same understanding? You are telling that stria, purple stria. Actually, purple stria. Is it the purple stria? Very, very right. This is the purple stria. Actually, subcutaneous fat is finished and the vessels are visible. This is the purple stria. It's compatible with this patient. Cushing syndrome. Cushing syndrome. Now this asymptomatic from the birth, the face appeared as such with the red area here. What is this? What is the name of this appearance?
Since birth.
Which doctor?
Bad
Sorry.
small.
Sorry, I cannot understand what you say.
Some navies.
Nevus. It is a red, doctor, red. And if you
Strawberry
press,
nevus.
if you press there, blood will disappear and come back again. It is not nevus. Again, you see,
Salmon bash.
Capillary
hemangioma.
hemangioma.
Yes, hemangioma. What is the name of this hemangioma in the face like this? Port wine stain. Port wine stain. What may be underlying disease name? Stork-Weber syndrome. Anyway, is a port wine stain. And maybe underlying capillary hemangioma in the brain, patient may develop with the cerebral picture. Picture means presentation of convulsion and other. But most of the time, it is only the cosmetic issue. It's a port wine stain. Okay, there may be some wine, red color wine. Again, this man looking to you. I think you understand now all of that is the picture of the same room. Yellow background and other. Anyway, you see what you are getting.
Myasthenia gravis.
And look at the eyes, doctor. The features in the eyes. What is this?
Horners.
Horners. To prove the
Horners.
horners. Okay, more likely to be horners. Horners may be a presentation of the malignancy of the lung. We will discuss this underlying malignancy. Suppose this big, little heavy person could have horners due to smoking and the lung malignancy. Less likely. Usually cancer patient will be lean and thin. It's just picture telling you. But you are getting the partial ptosis. Partial ptosis, okay? So this is a neurologic ptosis as muscle also working. One disease, doctor, you know that myotonia dystrophica. Have you heard it? Anyone can respond, please. Myotonia dystrophica or dystonic myotonic, whatever the name. Myotonia dystrophica. This is a myopathy. What will be the difference between this of myotonia dystrophica? Sorry, I couldn't pick a picture of myotonia dystrophica here. You will find that the bilateral ptosis will be there and the frontal muscles are smooth. Frontal muscles, sorry, take care of your noise, doctor. Take care of your noise, doctor, then be connected again. So the both forehead muscle will be inactive. Patient try to elevate the upper eyelids. So the disease is here. There's a muscle, big muscle in action, and patient just to see, try to elevate both upper eyelid. It seems to be bilateral partial ptosis. Bilateral partial ptosis. But it is unilateral, upper muscle is active, more likely to be horners. We need to exclude the horners here. Otherwise, without any symptom from the birth, if it is history telling, is a congenital horners. Now look at the face. Please, anyone be connected again?
Yellow sclera.
Very good. And then
This, yeah.
any other appearance?
There.
You look at the face, look at the nose, look at the nose. Is the nose normal? Seems to be depressed. Seems to be depressed. There is also bone. Bones are actually collapsed here a little because excessive production of the bone marrow product. Yellow. If you examine, what examination you like to do now immediately? Anemia. So patient is anemic as well. Yellow sclera, nose is as such. What may be underlying disease?
Thalassemia.
Thalassemia. Rather to say hemolytic anemia. If I don't address the nose appearance, look at the eyes. Jaundice anemia indicates more likely hemolytic anemia. But is it acute hemolysis or chronic hemolysis? Then you look at the nose. You see that this is an appearance of chronic process. Usually nose will not be depressed in any acute hemolytic disease. There is hemolysis, bone marrow overactive, so it is damaging some areas of the bone here. So nose is depressed. It indicates the chronicity. If you take the history, family history, you will understand that more likely this is, I am not telling thalassemia because I need to do the test for the thalassemia. Rather, we like to say chronic hemolytic anemia. Chronic hemolytic anemia. Maybe thalassemia or other region-wise other diseases may be there. But common is the thalassemia. Now, maybe thalassemia major or minor, you can say. Not guessing anything. Thalassemia major or minor? Could it be?
Major.
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 Major. Minor will not
Same
produce
like
jaundice or other. Normal. That seems to be normal minor. Okay. Elderly patient appeared as such in the eyes. What is the name of this sign?
This one.
Arcus senilis.
Arcus. If it is that senile arcus, then senile. Is it relatively younger or middle-aged? Rather to say corneal arcus. Maybe senilis or may not be senilis. corneal arcus. Then what we will search for further? We will search for underlying hyperlipidemia. Hyperlipidemia or any cardiac disease, right? Chest pain and other. This is our job. A patient presented with little breathlessness and dry cough. Okay. Without any other features other to say, patient have some mild joint pain somewhere. As a routine examination, when you try to see the anemia, you cannot pull down this lower conjunctiva. Now look at the skin, other part of the face seems to be shiny. Though the flash of the camera can create shininess, but I'm telling them the skin seems to be shiny if you see the patient lively. What is the possibility? Can anyone guess?
Scleroderma.
Scleroderma. So what you will see further thing in the patient if you suspect scleroderma? That is someone connected and again disconnected. Very difficult. Eh? Be connected, doctor, if you
Fish
don't have any
mouth.
problem. Is there any other feature in the face of scleroderma in the mouth?
Fish mouth.
Seems to be corrugated mouth.
Right.
Corrugated. Patient cannot open the mouth well. Microstomia. What you will get in the hand in the history? Raynaud's phenomenon. Raynaud's phenomenon. And when you look at the finger and try to elevate the finger like that, are you now clinically confident what is the disease? You cannot elevate well. You are trying the fingers. Sclerodactyly. Sclerodactyly. Now, one single diagnosis could be what you say. Fantastic, doctor. Congratulations. Very nice. Your idea is very nice. Scleroderma. So scleroderma can appear to us even in when we try to see anemia at that time. So this is the appearance of scleroderma. That actually, doctor, I like to show you the message from the pictures. Don't only look at the picture and memorizing some diagnosis. Now inside the mouth cavity, I think all of you know what is this long-standing appearance. Possibly you are right. You discussed before also. This is geographic tongue.
Geographic.
Geographic tongue. That was my patient, doctor, again to share. I'm happy that this is also few months patient having this, not few months actually, again long lasting, this black appearance. What is this?
Acanthosis nigricans.
Very bright, very bright, very bright. But if you look at the neck also, is there acanthosis? Yes, yes.
Yes.
Neck also one of the area. It means that acanthosis nigricans appearance at the site of friction. At the site of friction. Neck also you see skin become folded. So there is a friction. It is that much clear that very easily you can say. But in the exam, doctor, usually this clear picture usually not given in my experience. Usually they're giving the necks a little colored. So you have to suspect that it could be acanthosis nigricans. If the patient having the symptom, more likely patient might have even the abdominal malignancy. Other than malignancy, what is the reason of acanthosis nigricans? Patient weight is high. Obesity. And those who are attending the female patient, you can say that polycystic ovary syndrome. Maybe there. What is this? Painful blistering lesions. Appearance is as such. Please, can you repeat?
Herpes zoster.
Herpes zoster. So this is a midline, usually doesn't cross midline. But sometimes it crosses a little midline. Who can say the explanation? Sometimes it just maybe 1 inch, a few centimeter opposite the midline. This is the anatomical explanation. Who can say from anatomy? A little here. The cutaneous branch of the spinal nerve, there are medial and the lateral branch. The medial branch crosses a little of the midline. So if it is the medial branch is involved, then the herpes zoster may cross the midline a little after this, not too much. Okay. Now come to see some. To say
Clubbing.
it is of which country, doctor? Patient is from which country? Arab patient or non-Arab? What do you think? The cloth pattern?
Non-Arab.
Non-Arab. Yeah. Is it from Africa?
Maybe Bangladesh.
Oh my God. You are telling Bangladeshi. Have you seen a lot of Bangladeshi people, doctor? I don't know. You're guessing something, eh? Could be South Asian people, okay. Is a Bangladeshi patient. Yes, Bangladeshi patient. So cloth is telling something. Is it elderly patient or young patient?
Yang.
Young patient.
Young patient. Now look at the tip of the finger. What is visible here?
Nail bed is
Clapping.
What is the sign? Clubbing, right? Clubbing.
Clubbing.
And the color of the nail blue seems to be. Right? So patient is cyanosed, having the clubbing and long-lasting problem. What may be the possible diagnosis? Young patient. Maybe children ages. Huh?
cardiac cause.
Yes.
But doctor, can you repeat?
Maybe cardiac cause.
Cardiac cause. Which cardiac cause? Common.
This
Persistent.
infective endocarditis.
No, doctor, endocarditis will not last longer.
Vascular defect.
Infective endocarditis is not a congenital disease. It is a congenital disease.
of Fallot.
Very, very right. Very, very right. Tetralogy of Fallot. Tetralogy of Fallot. Common thing we have to think earlier. Okay. Now, the itchy lesions like that in the hand. What is the possible diagnosis?
Scabies.
Scabies. Any other possible-
Eczema.
Eczema. What is the? Is it the lesion, doctor? White seems to be macerated like and damaged tissue here. White lesions, itchy. If you want to take, the history, patient working in a restaurant where he is to serve water and other more. Right, doctor, those who are working in the Riyadh, maybe you can find that there is some market, a Bangla market, Yemeni market. People are working there in the hotel serving inhalation. What could be the possible
Eczema.
organism?
Fungal infection.
Fungal infection. Which fungus more likely?
Candida.
Candida. Candida. Very good, doctor. Very good.
This is Candida.
What is the appearance of this?
Swan neck deformity in rheumatoid arthritis.
Yes. It's very typical of rheumatoid, the swan neck. Yes. There could be Z deformity, right? There could be Z deformity, swan neck. And this may be Battonian deformity also, right? You see, this is also bent, right? So it could be Battonian. If swan neck only in the tip, if it is also such, but so all deformities are here. What about the muscle condition, doctor?
Wasting.
Wasting. That I like to add, doctor, today, especially in my session today, that you know that the appearance such, even undergrad student also can say, but there are some other features. The muscle wasting. So try to see whole picture of a photograph. What may be the complication of rheumatoid arthritis here other than this? What question you will ask one? If you asked, you can say that asking about the, let's say, carpal tunnel syndrome, maybe they're burning in the hands and others. Okay, so this is typical of rheumatoid arthritis, rheumatoid hand. So if I ask a technical question, we said that in the rheumatoid arthritis, distal interphalangeal joint is not involved. But you said that you see that the DIP appearance as such. What is the explanation of this? Can anyone intelligent one can say? This deformity due to joint problem or extra articular tissue problem here? Now you're stuck and stopped. Basically, all doctors are learning that DIP is spared invariably in the rheumatoid arthritis. And this is a diagnostic hallmark also to compare with other or differentiate from other. But you see the DIP is as such here. Why it is bent like that? It is not for the joint damage. Rather, there are some tendons and fascia, many things are there. They are involved in making such appearance for the swan neck deformities, not for the joint damage.
Mallet finger.
Whatever it is not for the joint damage. This young girl, rather a school girl, attended to me and actually accompanied with one of junior colleague. She was our student intern, her relative. Overnight, this girl have appearance of such thing. You see the red marks are there. Without any previous disease known, what may be the possible diagnosis underlying? We need to be diplomatic now.
Can be self-harm?
Psychogenic.
Iatrogenic means, doctor? What if iatro is done by the doctor? Psychogenic. Psychogenic.
Yes.
What
artifact.
Yes.
Can be hesitation cut.
Hesitation. She tried to suicide?
Maybe
What
she
is it?
tried to harm herself.
Harm self, but not suicide. You see the leg also, the down, you see? Leg also done. So it is done in the accessible part of the body, not in the back. So she has done by self. And interestingly, another colleague have seen her and given a lot of blood tests, thinking that maybe hematologic disorder. So if the history is not clear, if I don't guess something, I will do a lot of tests. Anyway, for my understanding, I discovered this and have an idea that it was done by herself, and the appearance nicely told by you, someone, that dermatitis are defect, and these are the sharp cutting also and parallel mark, doctor. Remember the parallel mark. There is some problem with the parents.
personality disorder or something.
Anyway, underlying psychological problem is there. So now we need to treat the lady by referring to where? Psychiatrist. This is the GP's responsibility. Otherwise, she will commit suicide later. Okay, doctor, I don't know how many time you are having. I'm sorry if I take more time. If you feel better, doctor, be with me a few minutes more. And I know that you can leave also if you want. Few minutes, I need to talk more, doctor. I believe, doctor, it is helpful for you, no doubt. It's very exceptional. I know that this picture discussion is less happen even in the internet and others. And again, I feel proud, doctor, that this my personal picture, not from internet source. Anyway, there are some painful areas in the leg. What could it be?
Erythema and endosome.
Right. These red areas are erythema. More likely underlying disease is what?
Ulcerative colitis.
Any other?
Sarcoidosis.
Whenever we say erythema nodosum, first disease we have to think is sarcoidosis. And it is acute sarcoidosis. Acute sarcoidosis. If associated with bilateral hilar lymphadenopathy, the term will be Lofgren syndrome. Lofgren syndrome. And the self-limiting. So this is erythema nodosum like that. This young lady, very girl, having the arthritis, joint problem, and tummy pain. And if you look at this leg, you find this type of red spots. What could be the spots? What could be the spots? I am asking you, doctor, please, anyone give the answer. Is it the bleeding or not? How to say?
Purpura.
Purpura. Okay, it may not be purpura. Suppose how to prove that this is purpura? Do one examination here.
Launching test.
Launching test or by the slide test. If it is purpura, what will happen?
It will disappear.
No. In the purpura, it will not disappear. It will not blanch. It is called the blanching. It will not blanch because this is extravasated blood. If the blood within the vessels, even in the capillary, if you press, blood will go and come back. Only by pressing by a slide, it will be very easily be seen. In our practice, just we do the pressing by the fingertip anyway, but method is slide test. So it is not blanching. Patient having a joint problem, so the painful joints, maybe swelling, abdominal pain. What could it be? And the purpuric spot prominent in the lower limb like this.
Is it Henoch-Schönlein purpura?
Fantastic, Henoch-Schönlein purpura. So for dermatology study, doctor, just to give you a message that you will read, where is the lesion is number one important thing. The lesions in the leg, hand, foot, wherever it is. So location of the skin lesion is very, very important. Very, very important. Anyway, I think you know the diagnosis, right? The repeated picture. In the leg, this is the appearance. What is the name of this? This is also a patient in Saudi Arabia.
Psoriasis.
Psoriasis. Where is the? Is there any inflammation, doctor? Psoriasis. Psoriasis will have some red background and plaque-like area localized. It is extensive. If I can show you other picture, you will understand. This person have the scalp, abdomen everywhere like this. Almost no other symptom. Only appearance is as such. Fish scale-like appearance. What is the name of that?
Ichthyosis.
Who said, doctor, have you seen such patient anytime?
No.
No, yes, but
No.
your idea is very right, doctor. Thank you. This is ichthyosis. Ichthyosis. Again, ichthyosis could be associated with some malignancy, remember, especially the urinary tract malignancy. So what question we will ask? What about your urine color? Eh? Are you passing red urine? So maybe we are near the end of our session today, and others, few interesting pictures. This young boy, adolescent, losing his hairs as such for few days.
Alopecia.
Alopecia areata.
Alopecia areata, because localized area. What other area you like to see very easily to be more confident that this is alopecia areata? Other than head, anywhere, anything in the finger associated with alopecia areata? In the nail, anything in the nail? Anything in the nail? Still not click. Features of autoimmune disease in the nail. It happens in the psoriasis also. Can anyone say again? Psoriatic nail.
Nail
So-
bitten.
Nail
Bitting.
pitting. Right. Sorry, doctor. Pitting. Nail pitting. Nail pitting. So nail pitting is the features of autoimmune disease. Alopecia areata, you will be more confident to say that it is alopecia areata and associated nail pitting. Again, this is like the vitiligo. We need to exclude other autoimmune disease. It is called autoimmune polyglandular syndrome. Anyway, what is the treatment of this?
Steroid injection.
Whatever it is, you know, doctor. This is not the time to discuss about. This lady is suffering of what is unusual cold feeling. What is this appearance? This patient having excessive cold feeling and gaining weight also.
Erythema FG.
Thyroid.
Hypothyroid. Erythema ebigni. Right, doctor. Erythema ebigni, the context of hypothyroid. What may be the nature of the lesion? Infective, neoplastic, degenerative in the scalp of this patient? Again, it's a matter of few weeks, maybe 1 or 2 months persisting lesion.
Plastic.
Why you are telling neoplastic?
The duration is like for 2 months.
Patient is young or elderly?
Elderly patient.
Elderly patient. By looking the hair color. And the lesion seems to be ulcerated and rough, light rough. Rather, appearance is not smooth looking.
Basal.
Whatever basal or squamous, we are not telling. Rather, we can have an idea, clinical view showing that it may be malignant lesion.
Amna?
And finally, doctor, it was proof that it was a malignant lesion. As it was my patient, I know. So how picture is talking to you? I tried my best, doctor. We're near the end today. Now look at this man sitting on the bed. You see the bed sheet is same of the same hospital night. Look at this abdomen. Oh, fantastic, doctor. Side is very right. And all of you understood. Now, what is the appearance of the skin? This appearance.
Liver failure.
What is that?
Petiki.
Petiki means bleeding.
Yes.
If you want to say the petiki, you have to do the slide test. These are not petiki,
Liver.
doctor. Petiki will be pin head, not this much big. You see 5-6 coin shape lesion.
Cafe or something.
Cafeola. If I tell you that if you press by the glass slide, it disappears. It blanches.
Spider nevi. Spider nevi.
Spider
Nevi.
nevi. Liver cirrhosis. Yeah.
So underlying disease could be what now?
Liver cirrhosis.
Liver
That's
disease.
a chronic liver disease, maybe cirrhosis, chronic liver disease. So you see a simple picture, actually you are looking at your patient. If you know how to look at the patient's diagnosis will be almost clear, some diseases are doctor. And today I have shown many common diseases also. Okay, now a little extra attention for the family physician, family medicine. I know this lady, doctor, she is 100 years lady, centurion. We appreciate her. And very fantastic, she doesn't have too much problem. If the centurion lady, I'm showing you another picture here. Okay, she has some problem of memory. So what is the name of this device? Can anybody mention the name? What is this actually for this lady?
This is the daily pill device.
Why she is provided with the device?
So she will not forget what she has to take daily.
Yes. She might be forgetful. These are the box. The name of the box is dosette box. Dose. From dose, dosette box. So this is the geriatric special doctor. Sometimes those who attend our OSCE classes, we know them this thing. There are some different boxes available. Morning dose, evening dose, night dose, like that, afternoon. So these are the geriatric special dosette box. So Sunday, Monday, like that, patient should not forget the daily medicine, right? Okay. One patient, have to look at huge medicines for few months. Those who are Arabic origin, that you can identify this name also here, Arabic names. You can see what may be underlying disease patient suffering from.
There's some kidney issue because he is taking Apimeg.
Is there a disease of heart, lungs, or GI tract?
GI, most probably.
GI tract. Maybe dyspepsia, IBS, peptic ulcer disease, right?
Yeah.
Okay. So sometime without looking the patient, looking at the medicine pack also, you can say that there's something wrong like that. Patient having some symptom like that. That is also how a picture talks to you, doctor. Eh? Not sleeping time, doctor. I hope you will not sleep today. And now they are at the end, doctor, really. And if you have any query or further, doctor, few question now I'm giving you, doctor. Anyone, if you want to ask the question also, you can raise the hand, doctor, no problem. As we come across some basic idea of the pictures, now I'm showing you exam related some questions. Please have a look and give your answer quickly, doctor. And if you will, I believe you will be much benefited if you observe the question. These are the questions from the exam. Those who are appearing Hecate will be very useful. What is the answer, doctor? And read some words also. If you say the P, I may understand D. B.
Most commonly.
D. All patients should be offered a statin. Okay. So you are thinking that definitely patient having hyperlipidemia. So you are sure hyperlipidemia. For that you are giving a statin. Any other option you said? Maybe B. Include laser therapy.
E. Yes, laser therapy.
The treatment of this lesion, not a statin. Remember, of this lesion is maybe the laser therapy to remove this, but underlying disease could be statin, the hyperlipidemia. So these are some options of the xanthelasma treatment. So will you do or will you refer? Doctor?
Refer.
To where?
Dermatology.
So these are the appearance of familial dyslipidemia, palmar xanthoma, eruptive xanthoma, doctor. As much as possible, we have collected the picture for you. Whenever you got the picture of xanthelasma, you will search this thing. You will search this thing. Anyway, patient may have missed this lipidemia. Okay. Next question, doctor. If you give the answer quickly, I can finish some case finish up quickly also. 70 years old patient. This is the picture in the face near. If you can show that you shouldn't confuse. With the facial area, appearance is like that. He is a retired sailor. It means there is some occupational importance also. What may be the diagnosis? Old patient.
C.
C.
Carcinoma.
Basal cell carcinoma. Basal cell carcinoma. Very, very right. You understood now. Next one. Two pictures given. This side and this side here. 60-year-old male. Eruption of the blisters. These are the blisters. Pain.
Herpes.
Herpes.
I think today's session more likely successful. The story is important, right? Pain in the affected area a day prior to the eruption. This is very important clue. And you see in the back, it is not crossing the midline. Very good, doctor. I am feeling better. Now look at this patient. What he will do now? What test he will do? Doctor, look at the face and seems to be obese also, right? Bulky.
C.
C. Why you are thinking C? What is the disease underlying? ACTH means you are thinking that any pituitary related problem.
Hypo.
Maybe
hypopituitarism. Doctor, hypopituitarism will not be that much bulky. Hypopituitary patient will be lean and thin.
Cushing.
So pituitary also can produce Cushing, but why you are not accepting ACTH? What will be the test first?
Short
B.
test.
Connective is the diagnostic one.
If you see that this is the Cushing unit, already you are asked that you suspect Cushing syndrome. So what test will be the best test to exclude Cushing syndrome?
Short 24 hours.
24-hour free cortisol. There may be other tests also from this 5 option. From this 5 option, 24-hour urinary free cortisol. Then you can go to measure the ACTH level. It is pituitary origin or not. Pituitary will have the Cushing disease. Terminology is important. If the reason is the pituitary gland, we will say Cushing disease. But before that, we will say Cushing syndrome. It may be drug-induced Cushing also. Fine. The next one. Please try to give the answer. Please try to give quick answer. This is a fundoscopy, maybe uncommon to you, doctor, but nowadays the Royal College of General Practitioners included this thing, not in the written, even in the OSCE exam also, you need to face some common fundoscopic appearance. So there is the disc there, appearance of the disc, this is the blood vessels, this is the retina. So who can say, please, a little advanced candidate, please share with us so that everybody can learn. A little, not detail, a little.
Combined oral contraceptives.
Combined oral contraceptive pill causing such appearance, possibly patient having the headache also. Okay. What is the name of this appearance in the fundus?
Papilledema.
Papilledema. And papilledema remaining retina is normal. So what is the name of the disease underlying?
Benign intracranial hypertension.
Benign intracranial hypertension. Benign intracranial hypertension or idiopathic intracranial. Though these are not as etiology but associated. For that, sometimes it is said as idiopathic intracranial hypertension. The reason is not clear, but sometimes associated with this. I tell you one scenario. You are treating a patient for the acne. And later on, patient develops such symptoms, and fundoscopy reveal this. What is the reason of that? Patient having this disease, idiopathic. You are treating for the acne. What may be the cause?
Retinoic acid.
You are using some medicine which can cause this picture.
Isotretinoin.
Retinoin.
Steroids?
Doctor, are we using a steroid for the acne?
Retinoids.
Maybe antibiotic. Antibiotic also, doctor, right? Tretinoic acid. Yeah. It could be the systemic one, not the topical. So you are confused here. Huh? Topical not. If you give systemic retinoic, vitamin A analog, it can produce, as well as the antibiotic. Now, what is the appearance?
Comedons.
Comedons, right. So it is the one of the appearance of the acne initially with a black head, right? Black head. Maybe noise coming with some colleague, doctor. Sorry, I muted you. Anyone can open also. The comedons. What is the appearance and the diagnosis? Yes, anyone?
Psoriatic nail.
Psoriatic. You are thinking psoriatic. Psoriatic. Could it be other than psoriasis, doctor? Anyone?
Onychomycosis.
Onychomycosis. So who said the psoriasis? What is your logic? Why not you are telling this is onychomycosis?
It's fungal infection in groin as well. That is why he's itching.
So is it psoriasis? Is the fungal infection? Fungal infection
No,
can happen in the
onychomycosis.
groin. And psoriasis also can happen in the inguinal area, doctor. How to differentiate?
Well, psoriasis with bitting
Doctor,
nails.
all the
Psoriasis.
nail is damaged already. How can you identify bitting there?
Lesions in other places.
Other place, doctor, other place lesion can happen in the psoriasis as well as mycosis also. Very right, doctor. I'm happy that you are arguing. Very simple thing if you want. Okay, groin, most common area of mycosis. You are right. Psoriasis can happen usually in the extensor surface. This is one. Another in the symptom, doctor. Can you say something about the itchy? Itchy, which is more itchy? Psoriasis or fungal infection?
Psoriasis.
Psoriasis.
No.
Yeah.
Fungal infection causing more itching. So if you that is the doctor that you now understand how to read a question and to identify the key words. I think some of you attended our previous classes. I can understand the voice of you. Maybe Dr. Abdullah is here. Am I right?
Yes.
Yeah. Thank you, doctor,
Yes.
to be with
Yes.
us again. I didn't forget you.
Welcome.
So that was our strategy. We try to teach you, or sorry, not to say the teach, to guide you rather, how to identify the keywords. Simply look at the nail and some disturbing nail. Okay, maybe some of that. It is not enough. We need to be thoughtful to give an opinion. From each question, doctor, try to identify this thing. Anyway, now, blistering disease, 78-year-old man. What could be? One question you memorize, doctor. What are the causes of blistering disease? Just memory. Now utilize your IQ, intelligence, how to identify the reason of this blister. What one? Can you repeat?
Vulgaris.
Vulgaris. Somebody said pemphigoid. Okay. Why it is not pemphigoid?
Age of the patient.
Age of the patient. So more age is pemphigoid or pemphigus? Please give the answer. More age in favor of pemphigoid or pemphigus? Not clear. Second question. Which blister is very, very thin and vulnerable to be ruptured easily? Pemphigus or pemphigoid?
Pemphigoid.
No. Pemphigus. Pemphigus. Just very superficial blister and you cannot identify the blister. Patient would
It's
tell
not
you that
shown
I
here.
do this. And the
It's not
age
shown
also
here,
high.
but there is mucosal involvement as well. in
Okay, okay.
pemphigus.
All clues will not be given, doctor, in this exam. You can have an idea from by looking the picture also. You see, you are looking a significant number of the blister you are looking. So this is intact blister. One idea, right? These are not ruptured in general to differentiate. Second observation, 78 is elderly. Elderly means it may be a paraneoplastic feature. And which is more common as paraneoplastic feature, pemphigoid or pemphigus? It is the pemphigoid. So summary answer is pemphigoid. Pemphigoid. If anybody doesn't understand, you can ask me also. Doctor. It's very simple clue. I told you.
That's mean that pemphigus will be like ulcerated or not intact?
Rather to ulcerated or abraded, you say. Usually, the blisters are not visible in the pemphigus. Very soft. Even by touch of the cloth also, it will be, what I say, the rupture. Okay.
And there is a
Easy
mucous membrane involvement.
Okay, you can see mucous membrane, but I'm telling that challenge of a picture to you, all the things are not given. Age and the appearance can tell you the diagnosis. More likely, this is pemphigoid.
Good.
Now this appearance, red eye. Please go through the detail and give me the answer. Sorry, doctor, there is some noise coming maybe. Please try to give the answer. Sounds are there, doctor, sounds are there, sounds are there. I am muted, please. Anyone first unmute by yourself and give the answer. Doctor
Fluorescent
Mustafa.
stain.
Huh?
Fluorescent stain.
Fluorescent stain you will do, right? Okay. Somebody said that you will measure the blood pressure. Somebody said that I will see the ESR. Okay. I hope that somebody will say different thing. Any other option, Dr. Reem? Dr. Reem,
Yes.
what is the answer?
He have in the history some he contacts sexually transmitted infection. Maybe
Okay.
he cannot walk. Like I think about
What
what is
disease of
called
sexually transmitted disease has given this appearance in the eye? This is a subconjunctival hemorrhage. Okay. There is some message also, doctor, though it is not evident here. I am just giving you some clue. As in the picture, suppose this type of subconjunctival hemorrhage, if you cannot identify the tail means the border, not visible, it may be connected with inside the skull. So it may be the bleeding coming from head, maybe intracranial hemorrhage somehow, may be connected and coming here. In that case, you may find something else also, maybe the black eye and other. But it is not clear in this picture. Patient does not have any other symptom, maybe only the subconjunctival hemorrhage. So patient is asymptomatic of the hemorrhage usually. And what may be the common thing to be done first? This is the question here. So if you think that ESR patient might have some inflammatory or malignant disease, eye swab, you are thinking some infection. So considering everything, what will be the next step here? Someone said that fluorescent stain. You are thinking that it may be corneal also, doctor? Fluorescent stain?
maybe for the abrasion, foreign body or something.
Abrasion. Okay.
Blood pressure.
Blood pressure. Sometimes. You see, patient is otherwise fit and well. You couldn't identify, doctor. This is the key message here in this question. Otherwise fit and well, and it happened in subconjunctival hemorrhage. Sometime otherwise fit person have high blood pressure.
Tension.
Hypertension could have this appearance, and the spontaneous recovery is the rule. But if high blood pressure, we need to control the blood pressure. Now, a child present with this rash. So the picture is the challenge for you. Look at the rash carefully and try to identify what is the lesion name, diagnosis, and give your opinion.
Advise that no specific treatment is needed.
Molluscum contagiosum.
Molluscum.
Somebody may tell something. Will somebody say something? Anything different? Dr. Zaidi, what are you thinking? Doctor, is it any viral lesion? Any viral lesion?
No,
Yes, it's a viral.
Oh, sorry. Noise is there. I'm sorry. So, what virus it is more likely?
Can it be chicken pox?
Chicken pox could be a possibility. Right, right. Okay. Could it be other than chicken pox?
Molluscum contagiosum.
Molluscum contagiosum.
Molluscum contagiosum. There is umbilicated lesion. Sometimes
Yes.
chicken pox is confused with this. Very fantastic doctor who has said chicken pox. And there is some differentiating point between chicken pox and molluscum contagiosum. In the chicken pox, you know that this is painful, febrile illness. There is an itchy. So you will find that surrounding the lesion, there is a redness in the chicken pox. And there is some blister, though there is some blister like there, maybe. So sometimes it may not be easily to be differentiated. Okay, so it may be molluscum, it may be chicken pox. More likely it is molluscum contagiosum, maybe. Yeah, the clear umbilication is there, but there is a vesicle also for the Newcastle chicken pox. But this vesicle invariably will be associated with surrounding redness. Surrounding redness. I'm sorry, doctor. Some of you have some problem of jack, maybe here, the sound system creating some rough noise. If you can understand, try to correct. Though we are near the end, don't worry. So this may be. So if it is a viral disease, whatever the molluscum or the chicken pox, specific treatment not needed. Even if it is the chicken pox, if it is the chicken pox, only the symptomatic treatment is needed. This is more likely actually molluscum contagiosum. Maybe patient having underlying HIV also. So it's advised no specific treatment. Spontaneous recovery is the rule. But for cosmetic purpose, there are removal of these papules also possible. Now this may be looking to you. Eyes are as such. Sorry, doctor, this is not a question, unfortunately. As quiz I couldn't give. Refer to ophthalmology. Okay. Sorry, doctor, it is not a question, maybe information. I'm sorry, the slide is missed. So this is called the squint. What is the test done to confirm? It is called the light reflection test.
Right.
Corneal light reflection test. So how to do it? I think I will try to show you now. You tell the patient to look at you directly and focus the light. Now you see the reflection of your light where in the center of the pupil or not at the center in the both eyes. What do you think? Anyone? Please.
Left eye not in the center.
You
Left
see,
eye.
it is in the
Right
center,
in the
but
center, left
it is
eye
not in the center. So
In
you
the
see,
left.
you see how minutely you have to see. Sometimes you cannot identify this is squint. Maybe that it is normal. It is normal. But you focus the light, you see the focus is not in the center. It is medially placed. So it means that the left eye is deviated. It is called the corneal light reflection test. Now the squint, and your thing is underlying maybe some dangerous disease there. For that, you, as a GP, as a family physician, your duty is to refer the case doctor. This squint, different types. You must read it by yourself, doctor. And this oral cavity inside, the teeth are black like that. GP is to face such thing, but patient presented with the ER pain. Patient presented with the ER pain, but having the mouth discomfort as well. For that, you open the mouth and look at this teeth as it is. What is the underlying diagnosis? ER examination normal. You see, patient presented with the ER pain, but ER examination normal. So why pain is there? Maybe a referred pain due to disease in the mouth cavity. What is
Dental
this?
caries.
Dental caries.
Dental caries. And there's a peculiar name in South Asian countries, doctor, especially in Bangladesh also. Somebody can say also who is from origin of Bangladesh. What is the name of the disease? Can anybody say? Insect in the tooth. I'm saying the translated form. Somebody said that there are some insects. here. There is some meat also. Some ladies before moving here and there, they are removing some insects. Small. It's another story anyway. I think at the end, doctor, as it's my pleasure having with you. And this is the link, doctor. I'm just 1 minute. I'm taking a few minutes that if you want to be with us, I'm giving in the chat box, doctor, quickly. Try to join here, doctor, in our, what is it, the Telegram. If you don't have the Telegram, you can discuss with us, doctor, by the WhatsApp, by inbox us. So those who didn't join, you can join with us, doctor, in the Telegram. In the meantime, you can click over there, or you can save this also. So this is the last you and doctor. Sorry that I don't know how much time I have taken. Our target is to take 90 minutes. I think it is as such. I don't know how much you have benefited, doctor. And now, any question from you? If you want, if you feel better, doctor, we can take some other special class also. On the last, I didn't actually add this slide here. As we have taken the ECG classes and others, and we some doctor attended before, so we have prepared the ECG class in the YouTube. But this picture class is not in the YouTube. I hope that I will upload it after some editing here, so that you can share with your friends so that they can see it. Unfortunately, I cannot give you the YouTube link. Many of you have seen our common YouTube link in different groups. You will find there. Even you can join the Telegram also. You can find the YouTube link and other information to communicate. So anybody can request us to take another class, doctor, in future like this. Maybe after 1 week or later. Maybe helpful.
Yes,
This
yes. We
is a
want to take
picture. What about the topic? What you propose? I will try my best to prepare myself, doctor.
psychiatry.
Psychiatry. Yeah, psychiatry is important topic. So at the end, doctor, this is the message. Those who are appearing the exam, what we like to do, maybe like this. If you feel you can communicate with us, we hope that we'll start in the coming month of this for this examinees. Those who are examining, you can join with us, doctor. Especially, we have divided the 12 classes here, but the ECG picture challenge are not included indirectly. We will provide you the master classes to you, and this type of class, ECG and others, it is needed, including the chest, the different X-rays common in the family practice. So this class link will be provided, you will see, but this in the short course, actually, we don't like to use more time. Just have an idea, introduction, and identify, analysis of a question. We design, and it may be the class of the 2 hours later, not like today, at 7:15 p.m. KSA time, with other regional time as such. So if you feel, doctor, interested, you can communicate with us. This is our WhatsApp number shown here. I think many of you know us, I believe, as I can identify the voice of some of you. So better, I advise to be connected in our, mainly the Telegram is there. But if you have any personal information you need to know, this is the WhatsApp number, doctor. You can make a snapshot also to preserve it and send us your request. So we got one psychiatry. If you have any other request, we will be with you, doctor, for a preparation even until your OSCE exam. It will be our pleasure. So with this talk, I hope I can finish now. If you have any further thing, you can talk to us, doctor, later. Thank you very much. Thank you.
Thank you so much.
Thank you for you, doctor. Thank you.